In the interest of community service, Power 88 presents live talk shows to inform, enlighten, and to stimulate thought and dialogue. The views expressed on this program are not necessarily those of the staff and management of KCEP or the EOB. Now sit back, relax, and enjoy the program, or call in and participate at 647-3688. Funding for community partners for better health on KCEP Power 88 is underwritten by the Southern Nevada Health District. And here is your host.
You are tuned in, and that we are going to get you the health education information that you need. The Healthier Tomorrow program is sponsored by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. Every year, 45,000 African Americans die from smoking-related illnesses. Don't become another statistic. We know quitting is hard, but not quitting is harder. There's no better time than now to live smoke and vape free. Why? Because we matter. For free help quitting smoking or vaping, call the Nevada Tobacco Quit line at 1-800-QUIT-NOW or text QUIT NOW to 333-888. All right. With that, I want to introduce our first guest. We've got a power-packed show today, and this guest, it's her first time on, but it won't be her last. She's actually my coworker and my friend from the American Lung Association Executive Director, Shannon Proctor. Good morning, Shannon.
Good morning, Will. Thank you so much for having me on. I'm so excited.
I am so glad that you're here. This is a big week for a number of reasons. This is a big month for a number of reasons, but you've got a whole lot going on.
We do.
So just tell the audience a little bit about yourself, then we'll get into why you're here today.
Yeah, well, like Will said, I'm the executive director for the American Lung Association. I still consider myself new to Nevada. I've been here about 6 years, but I love this community, and I am 100% passionate about making sure that we keep our citizens safe and healthy and combat lung disease in our communities. This month is a lot going on. This month is Asthma Awareness Month, but this week is not only our turquoise takeover, but it is Lung Cancer Action Week. And for those that know me, lung cancer and preventing lung cancer is, very important to me.
Yeah, there's a personal connection there. Can you share a little bit about that?
There is. I lost my grandmother to lung cancer when I was young, and my grandmother never touched a cigarette in her life that I know of. And by the time, like with most lung cancer cases, by the time it was diagnosed, it was, pretty much too late to do anything. And so that is why I'm so passionate about telling everyone who will listen, especially Black and Brown communities, which I'm sure we'll get into, that there is a lung cancer screening, and early detection, like with all cancers, saves lives. So there are ways to, find out if you're eligible for the screening to be covered by your insurance, but there are some cash pay options and some free options, and we just need people to be aware and to take their lung health seriously.
That is so true. And lung cancer doesn't get talked about often enough, but it needs to be on every billboard, which I know you're working hard to ensure that that's happening, but it's the number one cancer killer in the United States, and people just don't know that.
Exactly. People don't know that it's the number one cancer killer, and I think it's a stigma around lung cancer, right? I think people assume it's a smoker's disease, and that if I never smoked, I can't get lung cancer, which is not true. If you have lungs, you can develop lung disease, you can develop lung cancer. And so this is something that we should all be aware of and talking to our physician about. But yeah, the number one cancer killer, and it's definitely, if caught in earlier stages, is treatable, is beatable.
Yes, it is. So let's talk about lung cancer. Then I want you to share a bit about how folks can find out about it. So how often is someone diagnosed with lung cancer in America?
In America, someone is diagnosed, one person every 2.25 minutes, somebody is diagnosed with lung cancer. When we're talking about, the black community, 1 in 16 black men and 1 in 20 black women will be diagnosed with lung cancer in their lifetimes.
Wow. So since we've been on the air, that means 2 persons have been diagnosed. Mm-hmm. And in the studio, we have enough people where one of us would likely have a diagnosis.
Exactly.
Wow. So how many lung cancer cases are diagnosed early when the disease is most curable?
So nationally, only 26% of cases are diagnosed early when, treatment is most powerful. But in Nevada, it's even worse than that. Only 1% of the at-risk community are getting screened. 1%. Wow. The American Lung Association does a study, the state of lung cancer every year. And states are scored on their lung cancer screening rates. Nevada ranks 49th out of 51. And 2 years ago, we were 49 out of 49. So we haven't done anything to get any better. We just got 2 areas that started reporting that happen to have worse numbers than ours. So we're stuck in neutral here with lung cancer screenings.
Well, we've got to do better, and thank you for the work that you're doing to make sure that we do, in fact, do better.
Thank you.
I want to know a little bit more about awareness and research. How has that helped increase the lung cancer survival rate, and by how much?
Yeah, well, we've increased the lung cancer survival rate by about 40% over the last 10 years, and I think that's largely due to campaigns like our Lung Force campaign, which is our awareness campaign to defeat lung cancer, right? That's what this week Turquoise Takeover is all about. We encourage people to wear the color turquoise or turn their lights outside of their building turquoise to bring awareness to lung cancer. But we're making progress, and so there's hope.
Yeah, I mean, that's fantastic. I mean, it's one of those things where it's also awful because, we don't want anyone to have to deal with this. But by the same token, the fact that the survival rate has increased that much is really inspiring and provides a sense of hope for anyone facing this.
Exactly.
Yeah. So you mentioned Lung Force.
Yes.
I mean, just on the surface, it's like, okay, Lung Force, what are we doing? Blowing up balloons? Like, what's happening here?
We do a lot of that too.
But tell me a little bit more about the Lung Force, and you've got something really special happening tomorrow.
Yes. So again, Lung Force is our awareness campaign. It's all about painting our cities turquoise and bringing awareness to lung cancer and lung cancer detection, early detection and prevention. Tomorrow we have the privilege of turning the Welcome to Fabulous Las Vegas sign turquoise, and the Las Vegas ballpark tomorrow night where, we'll be taking part on the field, I think, doing some educational opportunities there as well.
All right.
Yeah. So, I mean, we take Lung Force very seriously. It's our one time to really focus. Our mission is so vast. There's a lot of lung diseases. There's clean air issues. So this is our time to really focus on lung cancer and lung cancer awareness.
Yeah. Well, anyone that knows me knows that Las Vegas is my favorite place on the planet because it's the best place on the planet.
That's
but
true.
that is what it is. But being able to turn the fabulous Las Vegas sign turquoise, that's a really, really big deal.
It's a huge deal. And we've been able to do that for the last 3 or 4 years, I think, thanks to some of our great board members who helped put that in place. But
you can name drop. Go ahead, talk about the board.
Shelley Berkeley, who's currently, I think, running for mayor. I think she's on our board, and she helped us get that put in place a couple of years ago. And it's great because it provides awareness that we couldn't get on our own.
Yeah, shout out to Shelley Berkeley. She is going to be in California, so she won't be able to make it, but you can come.
Yes.
We encourage you to come out to the fabulous Las Vegas sign tomorrow, May 11th at 9 a.m. and wear your turquoise or your teal or your bright blue or
close to turquoise as you can get, I guess.
Just get in the family. I got on a turquoise shirt today, and I love that jacket you got too.
Thank you.
Looks really good. And then join us at the ballpark. I will be there, and it'll be a great game. The stadium or ballpark is going turquoise as well, so it'll be a beautiful ambient setting that you can enjoy.
Yeah, and then, also come out Saturday. We'll be at Cornerstone Park for our Lung Force Walk. This is a community event. There's no cost to register, no cost to come out. Just come out. We have fun activities for the kids, but more importantly, we have information and resources for all of our citizens about, quitting smoking. If you suffer from asthma, COPD, if you want information about lung cancer, come on down and see us and just have a fun day and hopefully learn something that saves a life.
Cornerstone Park in Henderson, right?
Correct.
All right. And what time?
It's an evening stroll, so come on out, check in about 5 o'clock, take part in the activities. We're going to start walking about 6:30, and then as the sun begins to set, we're going to have a twilight ceremony in honor of those that we've lost to lung cancer and other lung diseases.
It's going to be beautiful. Yeah. So you're encouraged to come out, and you notice she said stroll, so you do not have to be athletic to participate in the Lung Force Walk. You can stroll, you can meander, you can even jog if you choose, but it's up to you, because this event is really intended to be accessible for all of us and really to honor those that do live with a lung disease. So Shannon, let me ask you this question. I'm going to ask it harshly.
Okay.
Who deserves to get lung cancer?
Not a soul.
Yeah.
Not a soul.
I want that to be really evident, because a lot of times, as you mentioned, that stigma is very, very present. And people feel as though, well, you smoked, so you deserve what happened to you, and that's not the case.
And I feel like it's one of the barriers that keeps people from getting screened and finding out, right? They feel like then somehow they'll be shamed or unsupported by people because they brought this on themselves, and you didn't. That nobody deserves lung cancer, no matter what decisions we've made in life. Nobody deserves any cancer, right? So, but I feel like that's one of the barriers that keeps people from being screened.
Yeah. So you've done something really special here, where you're providing something to folks with a diagnosis. Talk a little bit about that.
We are. So, Will, you know this. It's been very important to me since moving into this community that we make sure that we're doing what we say we're here to do. And one of our things that we say we want to do is to improve the quality of life for those suffering from lung disease. So we have our lung cancer courage kits that are available to newly diagnosed, and since they're new, everybody's newly diagnosed to us because we don't know you yet. But lung cancer courage kits come with information and resources for someone who is battling lung cancer, and some amazing comfort items from the American Lung Association that might provide you some comfort and support throughout your cancer journey. So we encourage anybody who is suffering with lung cancer, contact us. You can email us at nevadaevents@lung.org or go to our website, but get your lung cancer courage kit.
That is amazing. And sometimes just knowing people are thinking about you makes a world of difference.
Exactly. And, I love the information packet that we put in there because, we have all this information on the website, but when you receive a life-altering diagnosis such as lung cancer, the last thing you have the energy or the time to do is stroll the internet for information and resources. And so I like that we put it all in one place in a bag full of some comfort items for you.
Yeah, and where do people get these? What hospitals do you have on board?
So far we have Sunrise Hospital, Summerlin Hospital, here locally. I think we'll have a few at Mountain View Hospital within the next couple of weeks. We even have partnered with some of our hospitals up north. So Northern Nevada Hospital and St. Mary's Hospital up north are handing them out as well. So if you're seeing a doctor somewhere and they don't have courage kits, you can contact us, but tell your doctor you want them, you want a courage kit, and maybe we can connect with your doctor and get them some kits to hand out to their patients as well. They're free. They're free to our medical professionals to give to their patients. They're free to our lung cancer survivors. So let's get them into hands that will make a difference.
That's great. So the courage kits are free, and they're available not just here in Southern Nevada, but all across the state.
All across the state.
That is powerful.
It is. This is a big state, but we are the American Lung Association in Nevada. And so it's important to me that we are accessible to people in all communities, no matter your economic status, no matter if you're up north, a rural community, black, brown communities. I want to make sure that we save lives from lung disease, and that if you are suffering, that we're here for you to provide support and information and resources, no matter where you are in the state.
Yeah. So I know people are listening. They're saying, well, I know you mentioned something earlier about a scan. Talk a little bit more about how people can find out so they do catch it early if they have it.
Thank you for asking, Will. Yes. So if you go to savedbythescan.org, there is a test that you can take that shows if you are eligible to have it covered by your insurances, including Medicare, Medicaid. They cover these screenings as well, as long as you meet a certain criteria. So again, it's savedbythescan.org. It's like 4 or 5 questions, and then you go armed with knowledge that you can take to your physician and say, I went to Saved by the Scan. I'm eligible for this scan. Please refer me, and then they'll start you on that process. But you have to take that power into your own hands. So go to savedbythescan.org. And then if you don't qualify, but you still feel like you need a screening, I suggest you talk to your doctor about your concerns and see if there are other ways that they can maybe get this covered through your insurance, or that they can find some other options for you. But lung health is serious. If you can't breathe, nothing else matters. And I've seen that in person with people who struggle to breathe.
Yeah, we just claim to have come out of, we'll say, a respiratory pandemic.
Exactly.
So I think that really resonates with folks right now. When you can't breathe, nothing else matters. Mm-hmm. Wow. Shannon, thank you so much. Stick around. I've got some more questions for you, but thank you so much for sharing all of this important information with our audience. Saved by the Scan is so important. Again, be at the ballpark and at the fabulous Las Vegas sign tomorrow, so wear your turquoise. Even if you can't make it to one of the events, still wear your turquoise in honor of this disease. So, the Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. May is Stroke Awareness Month. Did you know that every 40 seconds someone in the U.S. has a stroke? Learn how you can lower your risk of a stroke by visiting gethealthyclarkcounty.org. Again, that is gethealthyclarkcounty.org. All right, I want to bring on my famous co-host, the lady with the most, right? From Minority Health Consultants, Elisa Howard. Good morning.
Good morning. And I just want to say that you two look fabulous in your turquoise, and you did not tell me.
You know, I was going to text you this morning and say wear turquoise, but then I was like, it's too early.
It's too late.
And that's not a color people just have in their closet.
Right? Just randomly.
Oh my goodness. So there's some awareness happening that you want to promote this month as well. So let's talk about that.
So teen pregnancy prevention awareness is also in May. May is full, okay? May is Mental Health Awareness Month. May has a lot going on with it. But teen pregnancy prevention is really important to me and dear to my heart. I was a teen mom. A lot of people don't know that. I went to school and I got my education. I went to college and all those things. And so, you know, have my own business now, so people don't think that, oh, you had trouble, right? Or you did something, you know, that you weren't quote unquote you're supposed to do, right? Because you've made it now, right? But that's not true. Everybody has their things that they've gone through, and teen pregnancy actually made me who I am. And my daughter is amazing. She also has a master's degree in education, and she now goes back and reaches back. But teen pregnancy prevention in the Black community especially is so important, because I was a child that probably should not have had a baby at an early age, because I lived in a middle class neighborhood, you know, went to a nice school, all of the things that we think would not qualify you for that. But that just shows how sexual health education is not doing well in Nevada. And I'm just going to say it like that, because even now with me teaching sexual health education around the city with different organizations, they're doing it because they're saying that their kids are not getting it within our school system. And so if that is happening and you notice that your children are not getting sexual health education and you just don't feel comfortable, you can definitely call Minority Health Consultants. We can come out, we can come to your house, you can get your girlfriends together, have brunch and tea or whatever, and I can just host a class for the parents so that they understand what teen pregnancy prevention is and how to talk to their kids, but also for the young adults themselves. So I've actually done that several times where I've gone and just with the kids, and they'll bring pizza and things like that, and we'll just have a good time, and we'll just have our sexual health education, and you'll be amazed by the questions that your teens ask without you being there. And then with the parents, they have so many questions as well. So just know that there is help out there. There's so many organizations that are doing this on their own. Unfortunately, teen pregnancy prevention funding went away a couple years ago, and so we don't have that actual program at the Southern Nevada Health District anymore, but there are people like myself who are still interested in doing that.
That is so important. My grandmother actually had my mom at 14.
Oh.
Yeah, so, I mean, that's an important subject.
It
and
is.
I think that you're such an inspiration because folks discounted her.
Yes.
They said you'll never be able to be anything now that you're a mom. And she went on to get her master's degree at 50.
Absolutely. I love her already.
At 50 years old. But she taught. She retired as a teacher. She raised 5 kids.
Yeah.
And has had a successful life and a joy-filled life.
Yes.
And I think sometimes we look at that experience as only the negative side, but there are so many beautiful moments that come out.
And the crazy thing is that back in the 1900s, teenagers were having babies. It actually changed, right? The generational things changed where that was a norm in those days. And then we got to the spot, I don't know even when it started, but it became stigmatized. You can't do that. You're supposed to look good and, show the family that we're of values and morals. And that doesn't mean that your values or morals were compromised. That just means that you didn't have education.
That's right.
And that's all that people need is sexual health education, condoms, birth control. What do I do if somebody pressures me to have sex? Mm-hmm. Those are the things that I needed, right? And so I reach back and I give back to those kids that don't have that, or their parents aren't talking to them about that.
Yeah, and I think one of the themes that I'm hearing running through our show today is really erasing stigma.
Absolutely.
Because lung disease is stigmatized. Oh, you're a smoker, and people kind of frown at you, not understanding. And so that is so important that we erase the stigma from smoking, erase the stigma from being a young parent, and erase the stigma around all substance use disorders.
Absolutely. The thing is just educate people. If you think that they should know something, then educate them or send them resources so that they can be educated on something instead of stigmatizing them, right? Mm-hmm. That's all that life, I think, is about, is if we become educated or aware that things are even out there to harm us or could potentially, do damage to us, then at least I know that going forward. I know what's going to happen. But if don't stigmatize somebody to say, oh, you did this or you did that. We're all doing things that we're probably not supposed to do. But who is the maker of that?
Mm-hmm. That's right. So before we bring on our next guest, I want to just plug an event that's happening in June 10th. That's a Saturday at 10 a.m. at the Doolittle Community Center. There is the Reality Tour, which is a community drug prevention experience. It is free for the community. There will be free pizza, prize giveaways, and empowerment resources. Hopefully, Elisa, you can bring some of that sexual health education as well.
Okay.
And Shannon, we'd love to have lung health resources there as well. But it is a free event. You can register online at www.cpbhlv.org. That's cpbhlv.org. And again, that is Saturday, June 10th. At 10 a.m. in the Doolittle Community Center. All right, with that, I'd like to welcome our next guest, Mikhail Holmes from the Southern Nevada Health District. Good morning, Mikhail.
Good morning, Will. Thank you for having me.
Absolutely. I am so excited to talk to you again. You are no stranger to this show. And to kind of borrow from your phrase, you're here so often because what you do matters.
Oh, thank you. Yes, it definitely does matter.
Awesome. Well, you're here today to talk about something that's happening this month called No Menthol May, and also in particular, No Menthol Sunday. Could you share a little bit about that?
Oh, yes. So No Menthol Sunday is a national event that was created. I believe this is, I want to say maybe the 5th year. It might have been longer than that, to be honest with you. But No Menthol Sunday engages the faith-based community in discussions about why menthol is harmful to the Black community. Southern Nevada Health District and the Because We Matter program borrowed that wonderful idea, and we expanded it for the whole month of May. So instead of just one day or one Sunday in the month where we're talking about this subject, here in Las Vegas, we will be talking about it every Sunday within our local African American faith-based churches.
Wow, I love that. Getting the faith community involved in health. The faith community loves the soul aspect, but the scripture actually talks about wishing that you would be in good health and prosper as your soul prospers. So this is something that is, I think, so timely, so important. And a lot of folks don't know that smoking is actually causing a lot of disease. It's the number one cause for preventable death in the country. Why is this so important for our community in particular?
Well, as you said, it's a concern for everyone, but we're speaking more on the African American race because we kind of suffer from different issues and conflicts that are unique to our population. Smoking, for instance, and menthol. We start smoking a little bit later in life, and we probably smoke less cigarettes than the other populations or the other racial and ethnicities. But we die at a much larger alarming rate. As one of the ladies that were on here, she mentioned about lung cancer with African Americans. This is probably the most common cancer that African Americans pass from. It is actually the second most popular cancer among men and women of the African American race, but definitely one of the number ones that we probably pass away from. It is also a big contributor of heart disease, stroke, diabetes, which are the number one causes of death for African Americans. So smoking kind of exacerbates those conditions and makes them worse. And if you are a person who doesn't smoke, secondhand smoke can also put you at risk for those same conditions. So people like your parents or your children that are around you that don't smoke can one day be diagnosed with heart disease or lung cancer just from the secondhand smoke. So it's very important that we know this and we spread this information to keep everyone safe.
That is so important, the secondhand smoke. So it's not just something that the person that is engaging themselves is affected by. This affects everyone in the household and anyone they're really around while they're doing it. Is that right?
That is correct. And secondhand smoke, when it comes to African Americans, we are exposed at a much higher rate, both men and children, compared to other races and ethnicities. So that is something that we also need to be very concerned about and aware that is happening.
Wow. So, Mikkel, you are a peer recovery specialist. You're a certified health educator specialist, and you've got your master's in mental health and wellness. So just share 30 seconds of your best pitch for why someone should quit smoking today.
Because we matter. That's exactly why we should quit. There are so many reasons why we stand up for our rights and what's important for us. Let's stand up against tobacco and smoking and vaping because we matter.
Wow. I mean, because we matter, that says it all, and we've got to believe that we matter and start acting like it is kind of my perspective. So your work focuses again on that flavor of menthol, which I think a lot of people underestimate how powerful menthol is because it cools, it numbs, it makes the harshness of smoking less noticeable. And so, I'm not going to get on my soapbox. We got 2 minutes left, but it's one of those deceptive practices that the tobacco industry has leveraged black leaders to come against and taking it as if it's a freedom issue. Can you just share really quickly why that's not the case?
Well, I hate to use the word infiltrate, but in my opinion, that's exactly what it is. The tobacco industry has infiltrated the Black culture and the African American culture and what is important to us in order to convince us to use these products, where there is supporting our local leaders, our Black organizations, advertising and promoting at events that are popular with African Americans. There's a lot of tactics where they use their marketing practices to appeal to us, and it's in a way that is kind of conflicting, because at one point the advertisement was more on a negative, derogatory way when it spoke about African Americans. It uplifted the slave burden that was happening during that time. And
That's
then
right.
as time
there's so much we really have to unpack in there, but we are out of time.
Yes.
Thank you for being on the show this morning. No, I appreciate you so much. BecauseWeMatterLV.com is the website, or GetHealthyClarkCounty.com. This has been A Healthier Tomorrow. I'm your host, Will Rucker, joined also with Elisa Howard. And as I always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop, and you matter. So live compassionately. We'll see you next time.